At this time of the COVID-19, social distancing is the new normal. If it is difficult enough in public spaces, imagine just how hard it is for families and in homes. For health workers in the front lines, interacting with their families after a day of work requires extreme caution. Now more than ever, families have to come up with ingenious ways to stay together, even though they have to be meters apart.
At the time of a global COVID-19 pandemic, these are the best times for families. These are also the worst of times. For health workers at the front lines, especially those working at the infectious disease units, each day is about putting their lives on the line. Social distancing has become the new social order, staying at least 1.5 meters apart from each other. Joshua Mutinda is a health worker, a pharmacist in Dawn Home, Nairobi. At work, he observes the guidelines that are necessary. Later in the evening, he has to go home and be with his family. Mutinda's daughter has to wait before she can embrace him.
Akifika babake amuhug, hata ananiuliza kwani baba hataki kutuhug. So tumemwelezea juu ya corona. She understands it's a virus, though hajajua kabisa virus ni nini.
Ni changamoto, sio kama awali ambapo nilikuwa naingia kwa nyumba, unakumbatiwa, unaweza ukainteract na mtoto, lakini tunafanya hii nikijua ni manufaa ya familia.
His wife and daughter don't receive him as they used to do before.
Sanitize cause na niko na spray, niko za aina mbili, na spray, alafu aingia kwa boma apeka viatu zake, anabeba mpeka kwa balcony, then from the balcony again I still spray him again, and then anakuja na make sure simu yake pia me spray, alafu direct kwa bathroom sababu sitaki hata kidogo tukaribiane sababu lazima aoge kwanza ndio akuje atangamane na mtoto.
Don't live in isolation. A human being is a social being, and once you are taken away from that aspect of being social, it can also have its own impact, negative impact. The uncertainty, the fear, it may be making that child to be easily irritable. So let us know that now there's so much of underlying issues which as a family we actually need to take care of each other.
For health workers, donning personal protective equipment includes performing hand hygiene, putting on shoe covers, gowns, masks or respirators if applicable, and gloves. Doffing, removing the PPE is done at the point of work. It involves removing shoe covers, performing hand hygiene, and removing gowns and gloves. It is the first step of protecting oneself and ensuring the infection is not passed to the others on the way back home. However, even with social distancing, the advice given is to stay at home. Experts recommend that to maintain social interconnectedness, families still need to find activities and routines to stay together.
Family members do things together. As much as you are keeping the social distance, like this is a fence, we can start cutting the fence together. Somebody is at that corner, another one at that corner, another one at that corner.
Dorcas Wangira, Citizen TV, Nairobi.